Hello, I'm Dr. Joe Prendergast. I'm here to tell you about my life, my experiences, and how you too can be benefited by doing what I have done. I have been in practice for over 35 years. I've done a lot of other things that doctors do in practice. I've written a lot of papers. I've done a lot of other research within the framework of putting everything together for my practice. And it wasn't until I was about 37 years old that I suddenly realized I had a problem. I had a CAT scan. The CAT scan was to tell me that I had no cancer inside me, but it turned out to tell me that I had the arteries of an 80-year-old man. I was thunderstruck. I was scared stiff because my father had his first major stroke at age 42. So I looked forward to nothing more than a nursing home career rather than what I was doing. I really was desperate to find out something new, and I began to work with Dr. John Cook at the Stanford Medical Research Center, where he does cardiovascular research, and they do a lot of patient care at Stanford University Medical Center. He took me under his wing, if you will, and told me more about Arginine that I'd never really known before. And although it gained more and more traction with time until it won the Nobel Prize in 1998, I began to take it in 1991. As I continued to take it through today, this is 2008, it was a situation where I really had no concept that I was going to be able to reverse my own atherosclerosis. So now, although I, at age 37, was told that I had a problem that an 80-year-old man usually would face, at age 71 today, I have the arteries of a 15-year-old inside. With this, it really has changed my entire life, the way I have looked at everything I do, and I have really embraced the concept of making this available to everybody on Earth. The Nobel Prize, I would have thought, would have done it, but we're going to have to push more because people haven't heard about all this, and it's very important and something really to remember. I have the ability now, not with the CAT scan, but with a machine that I got at Stanford for using waveform analysis that enhances everything we do because it doesn't hurt, it can be done quickly, and it really works very well. We have this disorder under control now, and we follow it with this waveform analysis device. We have a new device now. It actually gives us more information than does the original one that I got many years ago at Stanford. So I feel really wonderful talking about these kinds of things. It's sort of like the situation when we have this exclusive machine that gives waveform analysis that is portable, not just in a medical office. This gives us the opportunity to do more and more measurements on more and more people, bringing it to the fore, yes, but also enabling to know how good they're doing. I am 15 years old inside, as I mentioned. This is really something. When I first started with Stanford, we had a situation where it was $800 to do a test, $1,500 in some circumstances, and now we have a dramatically diminished cost. This is really striking, and it really is useful. This is the kind of thing that moves a lot of the office medicine into a public health arena. It enables us to even go outside the doctor's office to find out what else could be done to try and help people. And anybody who wants to learn about how to use this machine and how to use the Arginine can do what I do all day long. It's really a different situation. It is bringing a new concept to medicine and to populations in general. We are no longer coping, we are reversing. I reversed it, and anybody else can too. This is really a striking thing to be able to talk about. And this is a situation where all of us can really take this and make it really something for everybody else. It takes my passion and take it into you so that you can do some very good things for anybody you know or don't have the opportunity to meet yet, but will. I am so pleased to be working with Eric Glenn and the Synergy Team Global to get this whole concept out and to make everybody aware that this is possible, that can happen, just like the Nobel Prize imported, so to speak. So get to the person who sent you this, and then you can learn how to be involved in this too. As I always have been known to say, it's your time.